Hello, everyone. We're going to start right away with our panel number three, corrections in the pandemic. We've been talking a bit about the pandemic. We're alluding to it in our last two panels. And we're going to take a look a little bit more closely with a really stellar group of speakers to ask, basically whether all the hopes for correctional reform that we've had over the last year or so, or before that, can survive, will survive a revived tough on crime climate. And to take us there, I want to introduce us to our moderator, Maurice Possley, who will in turn introduce all of us to our speakers for the day. And Maurice is a Pulitzer Prize-winning journalist, author of 4 nonfiction books, based in California. So it's still early in the morning for him, relatively. And he is the journalism coordinator for this week's conference. So, Maurice, welcome. And I'll
Thank you.
hand the mic over to you.
All right, great, thanks. And thanks to our panelists for joining us. We're going to talk about correction reform, and a part of talking about that, I think we need to talk about, sort of where we've been and what's been going on. And I'd like to start with Alex. Alex Piquero is a professor and chair of the Department of Sociology and Criminology and Arts and Sciences, distinguished scholar at the University of Miami, is also professor of criminology at Monash University in Melbourne, Australia. Alex, I wonder if you could talk about your paper, The Policy Lessons Learned from the Criminal Justice System Response to COVID-19. And I think particularly journalists are looking for ways of getting into this, and how you talk about whether this could serve as a sort of a springboard for reimagining and reshaping of the justice system toward being more fair and just.
Sure. Thanks, Maurice. Happy to be here. Wish we were in New York City, like these meetings used to be in early March. And hi to all the journalists out there. I have a deep appreciation for the work you do, having worked with many journalists locally and nationally and internationally. So thank you for bringing these issues, at least considering them as you're here the next few days at this meeting. 2020, there was no playbook on the wall. It kind of said, okay, this is what we're going to do, at March 15th, and the world shut down. As there was no there for us to kind of take a hold of. But I think what's happened over now almost exactly 2 years is the coupling of the COVID crisis along with the murder of George Floyd in Minneapolis on May 25th, 2020. It should be a springboard for inspiring both a reimagine and reshaping of both systems to be more fair and more just. And I know people use the word reimagining all the time, but I want to move past reimagining and think about reshaping. And I think the context for this is that we recognize the fact that the effect of the pandemic on the criminal justice system and the policy lessons learned as a result have made the system look inward at what they could do better and how they could do it better. And it cannot and should not be considered and explored apart from the political context in the United States at that time and still continuing. The issues of the COVID-19 pandemic and the George Floyd murder and the marches and the unrest that followed that, they occurred simultaneously. That May 20th, June 20th, 2020 time period, they worked simultaneously. They also highlighted the interconnectedness of the criminal justice system, but it also highlighted and put a big spotlight on the racial and health inequalities that were there, but not really there for a lot of people to literally visually see for a period of time. The outcry for criminal justice reform certainly existed well before Floyd's murder and the pandemic, but the cause for reform continued, expanded, and became louder, even when police were tasked with enforcing public health directives. The lessons learned from these events have hopefully forced the criminal justice system to look inward at what they should be doing and how they should be doing it. And in fact, we have made some steps in that direction. Various decisions made in response to the pandemic, especially at its outset, such as decarceration, scale back policing, fewer arrests for low-level crimes, that had an effect, at least short-term, leading to fewer people's jail. And they have been identified as strategies to counter the overrepresentations of persons of color in the justice system. And it may have helped accelerate criminal justice change, especially at the local level. As you go up in the stratosphere of different levels, it gets harder and harder, as everybody knows, to move the needle. Yet these same justice-related reform efforts are inextricably linked to broader calls for health reform, so much so that it is impossible to not recognize how interconnected the justice and health systems are. This is especially true as the disproportionate mass incarceration of Black and brown communities has negative impacts on the health of those families and communities, thereby reproducing inequalities that exist within the justice system further outside the system. And look, as the system continues its reform efforts, it must be based on more than brainstorming ideas on a big pad of paper that all of us have been at those retreats for 3 hours and everybody brainstorms and write a bunch of stuff down. It has to be a full 360 evaluation that leads to incremental, we're not going to do this overnight, but sustained changes that result in a fair and just way to build both legitimacy that is needed in the community and the legitimacy that is needed in the justice system. Both of those sides have to have trust and legitimacy in themselves and then one another. So we have to start with transparency. Transparency, the absolute most important thing here. That begins with data, research, collaboration, and not just a seat at the table, but a voice at the table for everyone, including researchers, community members, and criminal justice system staff. If we learn anything else since the first part of 2020, it is that voices need to be heard and the voices need to be part and parcel of the decision-making. In short, the main lessons of the pandemic for public safety and public health are the same as the lessons for education, housing, food insecurity, access to health care, and so forth. By placing the shared collective, that is, all of us are in this together, above individual and tribal self-interest, we become capable of responding to the various types of threats, from crime and public safety to public health and climate change, and to what's happening overseas in the Ukraine. This in turn could help contribute to a lessening of the disparities more generally in the criminal justice system and the health system that would appeal widely across society and potentially foster more agreement. Reinforcing this shared space among people, their communities, and the nation more generally is a promise that is well within reach. Look, if 100,000 fans from all walks of life, be they conservative, liberal, Black, white, male or female, or whatever, can root for the same team on a Sunday afternoon at 1 o'clock, or go to a concert and sing that same song in unison, if that can happen for 3 or 4 hours a day in different cities around the world, then I think we absolutely can do this moving forward. And I think the twin pandemics, as I've called them, have spurred a call for action. And look, everybody wants change, lots of change. It's going to happen. It's starting to happen. We just got to have faith in the process and keep fighting that fight.
What message would you have for journalists in this process?
Yeah, I think for journalists is that there's multiple stories here. You know, the main story that people have talked about, and Professor Rosenfeld has done the best work on this topic anywhere, is documenting the changes in crime rates that we've seen, especially in terms of violent crime, homicide in 2020 and into a good part of 2021 for a good part of cities. But there's also lots of other actors in the process aside from the policing. There's the court system, there's the correctional system, there's access to healthcare, there's the de-intensification of jails and prisons as a result of what happened with the COVID spread. So there are other stories within the criminal justice system that are part and parcel of everything we've been dealing with moving forward. I think another thing for journalists to think very carefully about is that there are some movements and there are incremental changes in police departments around the country, in correctional systems around the country. So, you know, everybody has been, and maybe the world is what we were living with a few years ago. It was either this or it's this. And I think, you know, journalists are really good at unpacking the details within the criminal justice system broadly defined and trying to find those, you know, those nuggets of positive change when they occur. So I would recommend that they dig into that and in a little bit more detail.
Thanks very much. I'd like to switch to Jennifer. Jennifer is at the Southern Illinois University School of Law, and she's been there since 2014. That's Edwardsville? Is that where that is?
No, Carbondale.
Carbondale. So you published a paper, Compassionate Release in the Pandemic, a Policy failure question mark. And I'd like you to talk about your paper and the idea that can you give us a good kind of a good grasp on what this compassionate release program is and whether it's something that's sustainable? Has it been a failure? You're one of the clearest voices I've seen in a while on this.
I appreciate that. I research in the area of criminal justice and health law and that intersection. I'm a former prosecutor, also did some defense work and work in health law. When the pandemic began, I began to immediately track what was happening in prisons. It was just sort of a labor of love for me. It was a population I had studied before, and I was deeply concerned about sort of that crucible environment and what was going to happen. And of course, what happened was exactly what we expected. We saw quite disparate impacts. And the First Step Act that was enacted in 2018, which enhanced compassionate release of prisoners, was meant to be kind of a last option in many ways. It ended up coming to the forefront, though. I initially started to look into habeas corpus and other types of claims, but they took too long. And COVID was just happening so fast and was so lethal that very quickly federal defenders began to realize we're going to really shift into gear and use this compassionate release statute. And I don't think it was a failure at all. And we've seen double the rates of prisoners released on that basis. We still see, I think it was something like in the last 2 years, 17% about of those release petitions have been granted, but over 16,000 petitions were denied. And my research was looking at the reasoning in the federal court opinions on why they made the decisions that they did, because my concern is that the application of the statute has too much discretion. And so I was interested to see what priorities the judges would put in place when they had that much discretion. And it was disheartening to me. We have tremendous advances in our criminal justice system in terms of involving crime victims' rights voices, in terms of involving medical and mental health professionals, and all that sort of went by the wayside, and it was business as usual in the courts. So I don't think it's a failure. I don't think it's going anywhere. It actually has broadened over the last couple of years, and I am quite sure many lives were saved as a result of it.
The term, I'm thinking of it from sort of a public perception, and the term compassionate release carries with it the idea that, and I think that some people grasp onto it, that we're being soft, that we're, why should these people deserve compassion, kind of thing. They're there for a reason. When we had a Center on Media Crime and Justice had a conference in November on sort of rethinking punishment in this country. And that's, the end where we wind up with these high incarceration rates. And I'm wondering what your experience is, or what sort of you're using that to talk to journalists about how to wade into this issue of compassionate release, in terms of what's the benefit beyond the individuals?
The benefit beyond individual prisoners or individual members of the public? Okay.
Right.
So the impact on all of us is something that the courts had to consider. But when we talk about what do people think, and reaching out as journalists to the public, what portion of the public, because I think it makes a big difference whether you're talking to a readership that has no experience with the prison system, that is, quite rightly fearful of crime generally, and is worried in the middle of all of this with the pandemic itself. So it wasn't simply just releasing what they say as criminals back into communities, but it was also perhaps increasing risks of sickness. The prisoners themselves were very worried about the public's sort of COVID positive staff coming into the prison setting. And in fact, a lot of the prison rates, the problem was that the wardens and the staff and the guards were bringing the community's COVID into the prison settings without sufficient protection. But I would just encourage our media to consider that the communities most affected by crime are the same communities where most inmates are coming from. So I saw this immediately as a young prosecutor, that my crime victim might be my defendant the next month. And you get this cycle of crime and violence and inequity in the same community. So I would rather hear from those communities on what they want with respect to what is compassionate. And it's been an interesting question. I've had some pushback on this article that aren't, like on the crime victim piece especially, that aren't most crimes victimless. And I would push back on that. I would say even a possession offense, you know, and the drug offenses, no crime is victimless. I've served on mental health, substance abuse commissions. These have deep negative impacts on communities that need a voice. So I would love to see journalists, particularly in terms of some long form journalism, share what we have been trying to do with the criminal justice system in terms of humanizing it, bringing in more community voices. Some of it's restorative justice, but there's a lot more than that. It's also in terms of crime victim impact statements. And I could share with any journalist a set of research that was not easily found, where it showed that during the pandemic, crime victim impact statements that were admitted were all over the place. There were many people in the public that said, absolutely release this person early. This was never meant to be a death sentence. So I think that it's almost too easy to say that compassionate is, you know, polar opposite to tough on crime. I think that's too simplistic. And I fear when the press frames it that way.
Thanks very much. And I'm going to move on to Eric here, but that's, I think, something that merits follow-up questions. Eric Reinhart is an anthropologist, policing prisons, public health, psychoanalyst and resident physician at Northwestern University. I'm sort of really interested in hearing if you could sort of address some long-term consequences of not trying to reform the system as regards punishment. I mean, I'm thinking and listening to Jennifer, we're talking about has the pandemic, and this is probably simplistic, but provided us an opportunity because of the urgency and the compelling nature of it to move along what probably should have been moved along a long time ago.
Yeah. This is what I and a lot of people that work in spaces adjacent to the one in which I work thought at the beginning of the pandemic. This is an awful event. In a certain way, it's an opportunity. It's an opportunity to bring to light an emergency that in fact is occurring all the time, but is not recognized as such by the public. At the very beginning of the pandemic, in January, in February, and March, public health experts were calling for mass decarceration because we knew very well that US jails and prisons, which feature horrible conditions, would be sites for major pandemic spread, not just among the people who were incarcerated there, but in surrounding communities and across the whole country. And we saw this internationally. One of the first big institutional outbreaks in the world of coronavirus was in the Wuhan prison system. And then we saw it in Italy, and then we soon saw it in the US, and it took off like wildfire. This was an emergent context that nobody could deny. It was obvious. It also allowed us to trace certain kinds of harms that the carceral system perpetrates all the time, but often are invisible because we don't have data systems to track them. So we had an unusual amount of, it's still insufficient, but unusual amount of data with COVID. We had to some degree COVID rates inside jails and prisons, and we had COVID rates in communities. That's very crude data, but it's more than we have for the vast majority of health conditions in the US in terms of our ability to track their relationship between the harms that are perpetrated in jails and prisons and then kind of what goes back out to communities. What my research showed, and others have since been studying this, is that I started in Cook County actually in Chicago doing this work. I had been an ethnographer in the jail. I knew what the spaces were like. I was quite certain that there would be very rapid spread of coronavirus once it came to Chicago within this jail context. And we were correct. It's in some ways rudimentary because we didn't have sufficient data sources for a more sophisticated study. But by April 19, 2020, we showed that 16% of cases in the city of Chicago, and actually by coincidence, it's the same number roughly statewide in Illinois, were attributable to spread from Cook County Jail. That's after controlling for different demographic factors and things that we knew were associated with COVID spread. Then we did a follow-up study, confirmed this, and we looked at this nationally. And we saw that one of the most effective community level interventions you could have for reducing COVID spread was decarceration. Places that significantly decarcerated significantly reduced the amount of COVID spread in those communities, not just among people who were incarcerated, but in surrounding neighborhoods, precisely the neighborhoods Professor Brobst was talking about. These very marginalized communities, usually Black and brown communities that are already subject to higher risk of all sorts of things, including COVID. So this is kind of my starting point. But how I came to this in part, and this is not meant to be kind of a biographical statement, but to give you a sense of the broader context and why this matters beyond COVID alone. How I came to this in part is because after I met Paul Farmer, who's a public health physician, global health physician, who just died last week, actually. I met him in 2008. And we taught for 10 years a global health course. I was one of many people part of it, where one of the case studies that we taught was the post-Soviet TB epidemic in Russia and then in Central Europe and Central Asia that spread out from Russian prisons, and specifically the MDR-TB epidemic, so multi-drug resistant tuberculosis. This was manufactured inside prisons that operated like epidemic engines, epidemic amplifiers that then spread this disease into surrounding communities. And at the time in Russia, there were not drugs available to average people to treat multi-drug resistant TB. This is a horrific disease. This same thing has happened worldwide with HIV, with hepatitis C, with influenza. It still happens. There's a recent study in Paraguay that showed the country's whole TB system is on the verge of failure because of prison-produced spread with increasing incarceration rates. So this dynamic pertains to a broad set of infectious diseases and will continue to do so in the future. We will have more pandemics, but even without pandemics, this is happening every single year with influenza waves that we have. Nobody has measured this before because it's very difficult to do with data restrictions that we have because we don't track actually in a transparent way health conditions inside US jails and prisons. But this is happening all the time, but it also happens with chronic diseases. So exposure to incarceration, studies have shown, shaves off 2 years of life. For every year incarcerated, 2 years of life is shaved off one's life expectancy. That's one study. Another study, just I think it was by age 40, that people who had been exposed to incarceration had lost 4 years of life expectancy. There are also studies that show that this loss of life expectancy doesn't just apply to people who are directly exposed to incarceration, but to their families. And I'm certain that if we had data to show it, it would also spread to broader communities, to blocks, et cetera. The health consequences of exposure to incarceration are enduring and they are massive. We talk about hospital capacity right now, healthcare system capacity in the US in relation to COVID. How much during an ordinary year, how much of healthcare capacity in the US is spent trying to repair the damage that has been inflicted by a completely irrational punitive system that does not rehabilitate, does not improve public safety, but damages it considerably. And one of the most important things I think for journalists to address is this distinction, an artificial distinction between so-called public safety and public health. The biggest threats to safety in America are not homicide, they are not assault. They are diabetes, cardiovascular disease, infectious disease, health conditions, but also crime. What mitigates crime? Economic security, health security, social security. We don't have any good data to show that punishment like we inflict in the US or policing systems really substantially mitigate crime and violence. We know that these other things do. There's abundant data to show that. I just put a piece in Slate yesterday that cites some of this international data to show that cash transfer programs are one of the most effective tools for reducing homicide rates, assault rates, and other forms of crime. We need, as a collective in the US, to shift popular discourse and to reclaim public safety from criminological discourses alone, where it's measured only by crime rates. We need to think about public safety in terms of, one, who constitutes the public? It should be everybody, not including people who are incarcerated, not just privileged, wealthy communities who are concerned with crime rates and whether their property is being protected. Crime is important. I don't mean to dismiss this. But when we have a concept of public safety that is reduced to crime rates alone, then it legitimates all sorts of violences that we perpetrate against broader communities in the name of reducing crime rates while we condemn them to die from higher rates of diabetes, cardiovascular disease, infectious diseases, etc. That is not safety. And it is not serving an actual universal public. It's serving a very select particular public. So I think as journalists, one of the greatest services that media could do for the US right now is to really beat at this artificial category that has really been invented in some sense by the field of criminology and its collaborations with the policing apparatus for the last 100 years. I think to break that down and to make people see safety as something that extends beyond matters of policing and crime is incredibly important. I'll stop
Well,
there.
just to push back a little bit, because I'd be interested in hearing what you say. I don't necessarily walk out my front door and think that I'm going to catch a case of diabetes.
Right.
There are people that fear that if they walk out their front door, they're going to get assaulted or they're going to
And
get
why do they
attacked.
fear
And
that?
so that's when you know, how do you kind of frame it in the sense of, I guess, immediate danger or proximity to this kind of danger?
Well, there are many factors, and I think the framing is really important. One is the temporality of it, the time course you're talking about. I'm developing diabetes right now. I'm sure I have a terrible diet. It's not going to get me for quite some time. And so we have a different kind of calculus as we think through risks. But the other part of it, and a massive part of it, is media representations. How many films are there about the horrors of diabetes and cardiovascular disease? Well, I don't know, maybe a couple, but how many films are there about the horrors of crime? How many journalists are writing every single day about crime stories that grab people's attention, that are spectacular? How many spectacular stories did we have about public health prior to COVID? One a year, maybe? I mean, it's not something that registers. I think this is what media needs to change. I mean, to resist this attraction, it's very difficult because there are corporate interests that reproduce this, but resist this attraction to spectacular narratives of risks that are actually not the major risks that they are considerable, but they are not the biggest risks we face as a society. And we also have to think about what does it do to perpetuate these kinds of spectacular narratives when we see what kinds of policies they lead to, which are policies that do not, data shows us, do not improve public safety, but actually continue to undermine it. So I think it's on journalists to counter this natural inclination towards the spectacular, towards the immediate, and to help the public think in longer term frames, to think in data-driven population level frameworks, and to think about how our own self-interest is implicated in perpetuating these systems. I mean, this is what I think the pandemic, in a certain sense, I was excited for the possibility to bring forward change. I'm not excited by the 1 million people who have died by the pandemic, but it offered an opportunity to make people realize what it is we have been building in the US and what harms it perpetrates every single day, even when we're not having a pandemic, but now it's brought out. And part of that is that it allows us to show that even if you don't care about racial equity, you don't care about a more efficient justice system, you don't care about all these things, you're quite happy with mass incarceration as it exists, it harms you, not just poor communities on the south and west sides of Chicago or the South Bronx or wherever else. It harms everyone because it multiplies disease and spreads it to every corner of the country. And it does this all the time. And it does this in many other forms of harm that we will never be able to trace. Psychological harm, the trauma that comes with this, and how this reproduces violence in various forms, influences childhood experiences. So I think in response, there's a long-winded kind of indirect response to your question, Maurice, but I think what the pushback you're giving me is precisely the pushback that journalists have to be aware of and think about how do we constructively engage with that reaction that we can expect and subvert it so as to enable the public to see the longer term and the public interest stakes that are at play in these kinds of conversations.
Thank you. You mentioned, and I'm going to shift to John Wetzel here. You mentioned the work that you did at Cook County, and I spent most of my journalistic career at the Chicago Tribune, and so I'm pretty aware. I've been in Cook County jail, and the idea that percentage of cases were directly attributable, and you mentioned data from prisons, which you acknowledge is not great, but it's better than ever or in the past. And I do think, the Marshall Project did a lot of reporting on COVID in jails and prisons across the country. And it made me wonder, it varies, obviously, because you see some cases where you can't even get data. And there's, by its nature, journalists know how difficult it is to get information relating to the correction system. We have a voice of experience here from John Wetzel, who spent a decade in Pennsylvania as a Secretary of Corrections and was responsible for, he's the longest serving person in that position in the state's history and was responsible for a lot of reforms. I wonder if you could sort of riff for us on the reforms. Has the pandemic given us an opportunity? It's a wide open mic for you, sir.
Yeah, good, because I'm a stream of conscious riffing kind of dude. So I appreciate this and certainly appreciate the opportunity to give you all who are going to report on this important issue some context and just open the door to kind of reach out. My off the record conversations are a hell of a lot funner than my on the record. So feel free to reach out for context. But I did serve as the longest serving Secretary of Correction in the history of Pennsylvania. And up until October 1st, I managed this system during COVID. And I will tell you, 4 months out, 4.5 months out, and no joke, no rhetoric, I'm still recovering from the trauma of the last 2 years. I think what's accurate is we all are, right? But I think corrections is one of the groups that disproportionately got it. And I really want to make sure we kind of bifurcate jails and prisons. Just to give you a bit of history of me, I spent 20 years working in jails, culminating in running a county jail for a decade. I then spent almost 11 years as the head of corrections in Pennsylvania, which was the 6th largest prison system in the country, 51,700 inmates at our apex. I left with about 14,000 less of that, and 70% of that in a non-white population. So I built my career on analytics and really focusing and trying to minimize the impact of our policies around our response to crime, especially on communities suffering from poverty and Black and brown communities. That's been my framing forever. So let me just hit a couple issues that I think are really relevant and dig deep in a couple areas because, if Justin Timberlake was trying to bring sexy back, I'd love to bring nuance back to the discussion because Lord knows we've lost nuance. And I think to try to understand corrections and COVID in criminal justice, you have to have nuance. Let's start with some of the things we learned. Prison and jail populations, as we compare them to the capacity that they were built for, are very relevant. I would argue, and I haven't researched this yet, but when you look at prison systems, I would suggest that the more they're over capacity, the more problems you're going to see. This was really exacerbated or maybe highlighted by COVID. And just a framing piece around COVID, especially from a reporting standpoint, I think the benefit to what we've dealt with the last 2 years is that COVID was a pressure test. And I would suggest we're coming to the spring and some of us are going to get our hoses out and start watering our gardens. We're going to discover cracks in this hose we didn't know about. So I think COVID really highlighted the areas that corrections suffered the worst. And oftentimes we get away with it until we don't. It's one of the more opaque fields in the world, so you can get away with it for a long time if that's your framing. But I think what we learned is that the capacity thing is a real thing. So much of the country's capacity is in old prisons and in oftentimes buildings that weren't even designed to be a prison, that were designed to be a nursing home or a mental hospital that was repurposed for corrections. We found out that that's not a good idea, especially during COVID. It was never a good idea, but COVID made it worse because things like dorms and congregate living, it's impossible to control the spread of a disease that is airborne in that circumstance. In Pennsylvania, and I would suggest likely nationally, we found that our significant reduction in state prison population, our early data indicated, did not contribute to any increase in violent crime or crime in general. I would tell you last summer, as crime was peaking in Philadelphia, we looked specifically at the percentage of individuals on parole who contributed to the violent crimes in Philadelphia, and our percentage was flat and even down a little bit, and that's in the context of an 8,000 population reduction over COVID. So context, we went into COVID at 45,000. We, at the end of my term in October 1st, we were down to 35,000. And for the record, we didn't have the ability or the legislative authority to use any discretionary release. So we just maximized our existing release components and begged, borrowed, and steal, and did whatever we could to reduce our population. Because to the gentleman's who I'm following's point, you know, prison population and COVID, they correlate. And the closer you are to your design capacity, the safer it is. With one caveat: Pennsylvania is a state that has life without parole. So my population over my time reduced by 27%, by 14,000. Our number of lifers, and in Pennsylvania, life means life, stayed flat. So it's 5,300 of the 51,000. It's now 5,300 of the 35 or 37,000 that we have today. And that population is something that I think national reporting, it just doesn't make it. If you're basing decisions on science and potential future criminality, 60-year-olds who serve 40 years in prison are not going to create a crime wave. So I think that's something we learned during COVID. I think probably the strongest lesson I got is the import of jail and prison staffing. And let me be very specific. I think if you don't have a circumstance where you have an adequate number of staff who are properly trained and healthy, you're going to have a problem. And I think during COVID, every system got worse in all three of those categories. And I think when you talk about nuance, it's important to think of staffing as it's simply a supply and demand. I've seen very few kind of nuanced articles around staffing, and this is where I think it's real important to bifurcate jails and prisons. So let's talk jails first. At the jail level, staff turnover is generally higher. It's a faster moving thing. It's very local, and generally they pay less. But one of the things that occurred during COVID is where systems and court systems shut down. They don't really fully shut down because there's still perfunctory functions that have to happen. Those functions just shifted to video conferencing and using jail staff to transport the inmates to some kind of video unit or whatever. I think one of the positive outcomes is, yeah, we can do some of this stuff electronically, streamline the system, and instead of having people sit in jail for 3 days for a bench warrant that the judge is going to let them out right away, we could get the judge on a video conference before we ever lock them up and divert them. So I think we learned that. But when we talk about supply and demand, two things have occurred during COVID. There's a smaller supply of employees generally, especially corrections employees. I mean, we're seeing states, even poor states, increase their rate of staff. And frankly, it's too late at this point, right? Cows out of the barn, anything you want to use. But now they're increasing, they're doing bonuses to try to catch up. In Pennsylvania, fortunately, we went in with a 3% vacancy rate. I believe they're now at a 10% vacancy rate, but we were kind of best case scenario. So now we understand that you have to have a proper number of staff in. But then when the demand is increased, it exacerbates it. And at the jail level, all the court functions that are now being kind of supplemented by jail staff have exacerbated the staffing crisis. So I think it's really important to get your hands around that. I'm working with a series of jails. As a matter of fact, I'm going to a jail tomorrow that is down a third of their staff. And that's a third of their staff with what they needed before COVID, I would guarantee you, and I'm not going to tell you the name of the jurisdiction, I would guarantee you they haven't even identified how many staff they need to do what they're doing today. And the other thing on staffing, and this is applicable to both jails and prisons, is that I think some of the drivers of the increase in deaths in incarceration in custody. Now in Pennsylvania, 100% of the increase in deaths was attributed to COVID. But I think that any increase you're seeing in deaths, and I believe we're seeing a over 40% increase in deaths. I think it's 46%, but please look that up. I don't know 100%. Part of that, I think, is that one of the things that occurs that we don't talk about or credit is that there's these kind of ambient, unofficial contacts that counselors, teachers, all these, even people who work in the kitchen have with incarcerated individuals. One of the byproducts of this long lockdown for COVID, and I would tell you that we're the first system who did it. So I kind of innovated locking down as a mechanism to control the spread of COVID, which I think even as much as I've been scrutinizing it the last 2 years, I think it was probably the right decision. I think one of the unintended consequences are that we have less touch points for people who are incarcerated. And one of the things that jail staff, even the most challenged system, we train them to notice changes in behavior, changes in health. When people are locked down 23 hours a day, we lose the opportunity to identify that. And I think that when you're looking for an area of nuanced reporting, really digging down into the increase in deaths, incarceration, I think COVID's going to be a part of it, and it could lead to a bunch of stuff around COVID. But also remember, I think it appears as if, to me, the acuity of individuals coming into jails and prisons is worse. This is understandable because access to healthcare for all of us was frustrated early on. And so some of the chronic diseases are having a bigger impact. But I think it's really contributing. And then you lay on the layer of less supervision because of staffing crises. Even, you've seen articles about Rikers having a hard time getting people to appointments and even to get their medication. All these things, I think, are contributing to just a less healthy environment, coupled with how unhealthy staff is by working a bunch of overtime, but and still having all the challenges we do about students their kids being schooled at home and those kinds of things. I think I got to mention tough on crime. We cannot let that shit happen again. We're still paying for the poor policies of the 70s and 80s. And more importantly, the fact that we didn't measure these policies and kind of report on them objectively. I think a couple areas, a couple streams that I think are relevant. Again, things around staff health, a number of staff training. Most people didn't train staff over the last 2 years, and they're starting to train them now. But when you don't have enough staff, things like training seem optional. I'll propose just something for you to think about. There's not a college football team in the country, Division II and above, that doesn't have a strength and conditioning coach and likely a nutritional program. Our correctional staff, nobody even thinks about their health or these kinds of things, which exacerbate the staffing even more because we have a bunch of unhealthy people. I think incarcerated people, there's things we drew from this. In Pennsylvania, early on, we decided we were really going to focus on communicating with them and make them part of our resources. So we did focus groups. We got their input when we were trying to figure out safe ways to increase activity. We got their input for it. But I think a couple things. Our vaccination rate in Pennsylvania was 80% in the first wave because we did incentives early on and stuff. I think that making sure the transparency that we all strive for, and I think is an important part of corrections, needs to include people who are incarcerated. And I think we did a good job of that in Pennsylvania. I think as far as policy lessons coming away, I mentioned life without parole. I mentioned discretionary release is really critical as you're reporting, because the policy, there's no kind of standard policy. The policies vary. In Pennsylvania, we have absolutely no discretionary release. We had to create some programs that kind of stretch the imagination on gubernatorial discretion, those kinds of things. But and to someone's point earlier, you know, I have encouraged Pennsylvania, especially legislators who care about this issue, to just abandon the term compassionate release, because God forbid we're compassionate with people who are incarcerated. You know, that's like that's an insult or pejorative term at this point. So I think those words count, right? So one of the things we've been pushing here in Pennsylvania, and I kind of ran out of time on this, is medical parole, trying to use clinical words to describe something like doing the right thing, because we don't want to do that either, especially as it relates to incarceration. So that's my kind of stream of consciousness. I think I'm running out of time, but I appreciate the time and the opportunity to throw some things out in the ether here.
Well, we do have one question in the Q&A that is for you, and I was going to follow up on that, and I have a couple others, but I'll start with that because you mentioned it, the incentivization for vaccines for incarcerated people. The question is, how much did this program cost, and did you think it was effective, and what lessons can be learned from this sort of incentivization?
Yeah, first of all, the cost is and I'm not being disrespectful, but it's irrelevant to me. You know, we used the kind of quote unquote profits from the commissary account. We gave $25 incentives, which in the token economy that we have in incarceration is a nice incentive in that way. I took a bunch of criticism from members of the General Assembly. I mean, which is kind of a badge of honor. But if from a cost benefit standpoint, and even, you know, the first criticism I got was from a fiscal conservative, and I just did the math. We spent $25 of money kind of taken from incarcerated people anyhow, so not real taxpayer dollars. But one hospitalization, when you add in overtime, is probably about $60,000. So that's the comparative group. The math works so quickly that it's almost embarrassing for someone to ask that question when you get there. But I'll give you an interesting juxtaposition. The governor's office in Pennsylvania would not allow me to incentivize our staff to get vaccinated when vaccines became available for staff. They didn't have control over whether I could incentivize inmates because we used or incarcerated people because we used the commissary account. Our first round of vaccines had us close to 80% with the incarcerated population, and we had a specific communications thing to include each facility's warden doing weekly, we call them fireside chats. I was doing weekly messages, and I actually got vaccinated on camera, live, and all that stuff. Our staff vaccination rate was significantly lower. And certainly the staff dynamics and some of the MAGA stuff and all that stuff played into it. But the fact that staff were declined on the incentive, I think, played into it. So yeah, I think there's a lot to learn from this. I hope that answers your question.
It does. I just want to follow up with a couple things you said. One was the idea that you looked at people on parole and in terms of what was going on in Philly, and I know that I kind of follow that because with my current job in terms of Larry Krasner being
Yep.
one of the quote unquote progressive DAs, and you mentioned that really was flat. I find that, were you surprised by that, or was it, what was your reaction to that?
So when you're running the system, it's not about emotion. It's relieved that it didn't happen, so it's not my fault kind of stuff, to be honest. But I wasn't sure. I know we pumped a bunch of, and just for more context, Philadelphia, 27% approximately of state prison commitments are from Philadelphia. So that's the largest feeder of the system. So when murders jumped so high in Philadelphia, it was a logical thing to do for us to look and see both Philadelphia, and then we looked statewide. And there was, I think, about 5 jurisdictions that saw an increase in murders, and none of them had a significant increase in the percentage of people on parole who committed the murder. So yeah, it was a more of a relief thing. But I think from a reporting standpoint, I think these are the kind of checks and balances that you can quickly get data out to stop some of the kind of narrative that's based on anecdotes but not supported by data. Now, admittedly, most systems struggle with being able to tell you this data, and I think that's certainly a weakness. But yeah, that's what we did in that context.
You talked about the reduction, 14,000 in sort of the total number. How much of that, if you can say, was related to the inflow was less?
So let's reduce it to the 8,000 reduction over COVID, right? So before we got to COVID, we were a reduction of 7,000. And just real quick context, prison population is really, the formula is real simple. Number of people come in, how long they stay. So if you want to impact the population or reduce it, you either reduce the number who come in or reduce the length of stay. So our approach during COVID, so before we did some things that reduced the number of people who came in. We reduced some discretion on technical parole violations. We eliminated some charges eligible to come to state prison, and then really started drilling down when I took over parole, really drilling down at almost eliminating or trying to eliminate technical parole violations that didn't have an actual real world nexus to violence, right? But when you talk about the reduction of 8,000 during COVID, what we did is we recognized that the courts were shutting down, which meant that we were going to get a finite number of people from county jails, right? So in theory, everyone who was currently sentenced to state prison in the county jail, that was our risk of the number of commitments. So frankly, we didn't shut down new commitments from counties, but we based on our COVID rates in prisons and their COVID rates in counties. So if we had a county that was really struggling and it looked like their COVID rates in their jail were going to go up, we would take their state commitments ahead of other counties to try to, because we took the premise that statewide, all the corrections agencies had to work together. So, but the shutdown or us being able to control the front door suggested that if we could really open the back door up wide, we could achieve a significant population reduction. We thought we had a deal with the legislature to create a circumstance where anyone who was on the vulnerable list, and that's people who had risk factors for COVID, who had a crime without a victim, which was about 12,000 people, something like that. No, it wasn't 12,000, but it was 4,000. Had 12 months to go, we could have released them immediately. That would have given us the immediate bump up front where we could have single celled and really spread people out and really achieve social distancing. Because again, we went into COVID at about a 95% of capacity rate, which is very low for the country. When that deal fell apart, we didn't have the opportunity to get discretionary release. So then we turned to, we're indeterminate parole state. So we use a parole board. So our next thing is, as unrelated as this sounds, is making sure every parole board member had their houses wired so they could do hearings. We made sure our staff who were responsible for preparing people for hearings, doing the paperwork, all that stuff, were designated as essential staff. And we just put a focus. We said, we're going to be as efficient as we've ever done. And we're going to as we've ever been. And we're going to maximize our existing stuff. And the combination of that and almost eliminating parole violations. And when I say almost eliminating, in the first 3 months of COVID, with 43,000 people in supervision, if someone was going to come back on a technical parole violation, I had to permit it. And you can imagine how busy somebody like me would have been. So that's the message to the field. Like, you better be freaking serious if you're going to call me to lock somebody up. So I think it was a combination of using existing things because we didn't have discretionary release. Sorry if I was long-winded on that.
No, it's good. I there's a question that's for the whole panel, but and you all can decide who wants to take it first, although it seems to be a little bit in your wheelhouse. But how bad is the problem of prison understaffing? And I was heading to that in various fields such as
Oh, it's
guard
horrible.
versus
No, it's a
and how does
risk.
this impact the population, and what can you do about it? I mean, you know, these are tough jobs to begin with, and then you introduce a pandemic.
So, yeah, staffing is the biggest crisis we have right now in the field of corrections is staffing, and it's getting almost no press. You see stuff saying understaffed and these ridiculous vacancy rates, 20, 30, 40%. It's a linchpin to everything. So let's kind of break it down a little bit. You've seen, and just on reporting. So there was an interview with Vinny Schiraldi, former director of Rikers, who said, listen, I'm admitting people aren't getting to their medical appointments because we don't have enough staff, right? So the impact of not having enough staff starts with the basics. So when you are low of staff, you reduce your operation to the point where all you're doing is like constitutional stuff, feeding, bathing, minimal amount of out of cell time, medication, access to medical care, right? That's the core basics. If you're at a place where there's, for instance, 1,000 incarcerated people and 8 people show up to work, all you're going to do that day, you hope, is feed people. And what the only way you're able to even feed people is that you're going to use incarcerated people as part of the force to do that, right? And hopefully you'll get meds out and those kinds of things. So staffing is a linchpin. Is it? We're in a new day now, and I think that there's a confluence of, I would argue, 3 things. One, the kind of designation of correctional staff in most systems, in most places, it's not seen as kind of a high level, sought after job. Juxtaposition with that, with Europe, which I've done, a fair amount. I was on the first Europe America exchange that kind of started this movement around European practices. Those are sought after civil service jobs that people seek to achieve. In Europe, they require at least 100 IQ. In Pennsylvania, that would be a violation of our civil service process to require a certain level of intellect. And that's a true ass story, believe it or not, folks. So that's one kind of thing. I think we need to increase the thing. There's no regulations. So think about this. Your forklift driver cannot drive longer than X amount of hours, right? The person who's overseeing your corrections could work 24 hours. If they're reporting it at New York, they're working 24 hours. That's okay. I don't know how that's okay. So we have this structure where we devalue the position in the first place. There's zero, or if there's not zero, statistically, there's zero health, wellness, employed staff members to try to ensure that correctional staff are healthy enough to show up for work and do what we ask them to do, which is getting more and more complicated. It's not a position that's super valued. That's one thing. In many systems, it's not well paid. So recruiting, being strategic, those kinds of things. We're also inefficient as hell. Historically, we haven't done a good job of being strategic at when staff was there, how we use them, how we deploy them, what's the most efficient schedule? Is it 8-hour, 12-hour? Corrections, unfortunately, is a system that's done it the way they've always done it. So I think that exacerbates it, but that's the path out. So the path out is to increase the value of the system, but get more efficient and then look at the demand. Like we got to stop acting both sides of the aisle. Like we need to incarcerate this many people to be safe. And so we need significant scaled population reduction. And the reality is the data would tell us what the categories are. We just don't have the balls to do it as a society. I mean, that's the real thing. So you scale it down to what it should be. And I'm not one of these cut 50. I'm not as smart as those guys and you guess a number. But cut it down when we agree on who doesn't need to be incarcerated, cut it down to that. And then we're in the ballpark and then figure out what we really need our corrections to be. And when you improve the environment, I mean, I think the final thing is when you have places that have a better environment, the irony is you need less staff, because when the environment's better, there's less fights, there's less individuals arming themselves, because it goes back to Maslow's hierarchy of needs. If you're not feeling safe, you're going to do whatever you need to be safe. That's true for everybody on here, and it's true for people who are incarcerated. So I do think there's a path out. I'm just not sure we have the political courage to write checks and to get us to where we need to be. And frankly, the people who really care about incarceration generally don't care about corrections staff. And so that's the other kind of juxtaposition, that they're a key part. They're the outcomes, they're inextricably linked. I mean, you can't have terrible correction staff and great correctional outcomes.
I'd like to go around the room, but before I do that, one thing I'm going to ask Steve to jump in here for a second, but one of the most impermeable areas in terms of journalism are prisons and departments of corrections, you know, I've long believed that those should be more open, and they resist that. Just to kind of keep that in mind in terms of how we can how reforms can take place. But Steve,
Right, that's actually a segue into what I was going to.
I'm sorry, let me respond to one comment, because I said something about compassionate being a pejorative term and some comments on that. I'm not saying that from a real standpoint, but I'm saying if we want to really change this stuff, you have to get in the real world that goes through politicians who don't want to look soft on crime. So I don't think compassionate release, I don't think compassion's a pejorative term, but if you want to get the bill passed, you just have to be very cautious about how you change that language. Didn't mean to interrupt, Steve, but I had to address that.
No, that's fine. No, I just wanted to segue into, and I didn't want to get back into the narrative, the language that we used. I hope everyone in our panel will comment on, which is particularly important for journalists. But we had a conference about 2 months ago on revisiting or rethinking the American way of punishment, where we looked at prison conditions and changing prisons themselves. And we did have one person representing the correctional officers, the unions, the National Union of Correctional Officers, not officially a union, of which there are very few. And it's very hard to get correctional officers in the discussions that we have about prison conditions, about incarceration. But I'm going to put a link into the chat room to that discussion that we had with him, because I think people will be really interested in hearing what he had to say about the conditions that correctional staff have had to face during the pandemic. I mean, their mortality rate has been higher than pretty much any employment group in the nation. So I'll just back off on that, but I'll get that link and put it on the chat room.
Great, thanks. I'd like to take a spin around the room and start with, in order of appearance, with Alex, and sort of, now that we've gone through everyone and you've heard some of the questions, chime in.
Well, following John is an impossibility. But this was actually a lot of fun for me, because I learned a lot about people whose work I've long admired and learned from. I think for me as a criminologist, during this time period, and I work with policing officials, with court systems, and with corrections departments. So I get to see what they had to deal with during this process. And the Coral Gables chief of police, Ed Hudak, told a TV station right at the beginning of COVID, he said, and I said at the beginning, there's no playbook for this. So all three parts of the system were flying blind without a coordinated response, because all the messages from the counties and the states were conflicted. They didn't have any PPE. They were trying to figure out how to keep themselves safe, much less their staff. I mean, here in Miami, they shut down the courthouses. They had to shut down parts of police agencies because 10-20% of the officers were gone, and they still had to respond to calls. There was still stuff going on. And then people were getting sick in facilities, whether they were jails or prisons. people who work there, vendors who work there, they're going into the facilities and out of the facilities. And, I think, journalists have appreciated parts of that whole thing, but all of us on this call, we understand the system is coordinated and linked together. And, a lot of times people, are only focused on one little thing. And, in the last 2 years, a lot of the attention has been squarely placed on the police for lots of different kinds of reasons. But there are other layers of the system and other levers that we have learned to use that can make decisions about who needs to be in prison and or jail, and for how long they need to be there, and what we do once they're in there. And I think that that's some things that I hope people will appreciate going forward. Because I'm always, I'm not maybe too optimistic or naive, but I'm always trying to find the good in the crazy that we've all been living in. And I think there has been some good that has come out of this. So that's my take right now.
So Jennifer, I didn't know this, and maybe I should have. You mentioned that you were a prosecutor in a previous, and so that's an interesting perspective. And I'm wondering what that brings, what you bring from that life to the table in terms of your research now and the issues that we're talking about, and some of these, the problems that we're trying to figure out how to rectify.
Well, I was in my 20s at the time. It was one of my first jobs out of law school. But even before that, I did my undergrad degree in Cape Town during apartheid. And, so I had some exposure early on, even though I'm American, to see the push and pull of systems and disparate impacts and all of that. And that it's always so nuanced. And I just think that there wasn't a single prosecutor that I worked with or single public defender that I worked with that didn't see people as people. And so when we frame these conversations and dehumanize the parties, dehumanize the policies, dehumanize the prisoners, that's just got to stop. Because I just haven't met anybody like that. I've had defendants in a sentencing hearing, if I drop something, pick it up and give it to me and say, here you go, ma'am. People are people, and people are on the whole pretty good in my experience. And so that has influenced me all the way down the line. One thing that I will mention here, though, that is, I don't really feel like we're in the sky is falling stage anymore. So I think that the journalism around these issues should settle into really diving deep into the research that we have known. Because when I first started writing, it was hard to find stuff. And I spent a very, very long time, many hours trying to find what I could to write what I did. But now it's really easy. All of a sudden, there are year-long annual reports of what we did during COVID. So I think that the language needs to change now in terms of what we know. And I also think that, yes, the system was sort of caught unprepared, but it wasn't the first time. And to be honest, Ebola could have been our COVID. And Ebola wasn't that long ago. And instantly, I was already pretty aware just from my work on what first responders do, what systems we've been trying to put in place after Katrina. Systems have gotten more coordinated than they used to, still not even close to where we need to be. But the fact of the matter is a lot of good has happened here. And I agree that it's political, but I personally think our criminal justice system needs to start really thinking of itself as in terms of sort of first responder crisis response for the next COVID. And I think that, or whatever it's going to be, or whether it's going to be climate change and flooding in prisons, I don't know what it's going to be, but that preparedness, the way it works, if we're talking about a tornado in Missouri, is detail in terms of step by step by step. What we did in the criminal justice system and in the court system was have excessive discretion. No, we need to do the opposite here and have, like we were talking about at the state level in terms of discretionary release. You don't want whole discretion. You want fleshed out, we can anticipate where our problems are going to be, and this is what we're going to try to do. And it's really not that difficult. So I don't, as much as I think we're all reeling emotionally from what's happened over the last 2 years, there's some really great players in the mix here who are doing some very pragmatic things. And I do think it's doable.
Thanks. I'm going to flip it over to Eric. But
Yeah.
before I do that, I just want to interject, a thought as I'm listening to y'all, and that is this whole idea of the injection of fear that goes on. And anybody who might have watched the judicial confirmation hearing of Nina Morrison, who's an Innocence Project lawyer who's exonerated almost 24 people, some of them from death row, and to hear people like Ted Cruz and Josh Hawley say that she was one of the reasons for the uptick in crime. It just such a disconnect, and yet it's out there. And those are just sort of the more egregious examples, in my opinion, of the fear mongering that does go on out there. And so, in terms of getting what you're talking about, Jennifer, that good things, I think that has to be part of the equation for journalists and how you confront this fear that people prey on or rely upon. And so I'm sorry, I'll get off my horse for a minute and turn it over to Eric.
Yeah, John is an administrator inside the system now trying to change the system. The rest of us, we are academics. I'm also a psychiatrist, a clinician. I'm right now in a psychiatric ward where I'll go back to treating patients after we're done. I'm well aware that there are people who are not safe among others. They present a risk to themselves or a safety risk to others. There is a need for some kind of custodial care system in the US. I don't think it's our current jail and prison system. I'm going to risk going against the grain in some way, in that I'm kind of anti-nuance. I'm anti more and more sophisticated research. This is a system that needs to be pruned with a chainsaw, not little scissors here and there. The Brennan Center has a study that about 40% of people who are incarcerated in the US prison system, there is no public safety justification, no conceivable public safety justification for them to remain incarcerated. We don't have an understaffing problem, we have an over-incarceration problem. This is what John was gesturing towards. It is very, very reasonable, even within kind of what I regard as rather conservative criminological frameworks, to release 40 to 50% of the people who are currently incarcerated in the US in the prison population. The jail population, 75% of those people have not even been convicted of a crime. They're there pre-trial, many of them because they simply can't afford $1,000, $2,000, $3,000 bail. This is not a system that requires a lot of really nuanced sophistication to make initial major changes to. And when we talk about fear, every day we encounter Fox News, or just as well NBC, MSNBC, whatever other, New York Times, these incredibly fear-mongering articles with spectacular violence that reinforce the existing system. You can't meet the politics that generates effectively if you're trying to meet it with nuance and more data and this kind. We need to have a massive unified political front that generates affective investment in a collective project of repair. Not a scholarly project of, which data-driven policy can we prune the system a little bit with here and there. I think in order to make real progress, and I don't mean this as disrespect at all to Alex or Jennifer or to other academics who I respect, and I understand this is how we are trained to think. I think in some way we should think this way. But when we're thinking about political movements and how we actually achieve material effects for the people for whom the sky is falling still and was falling before COVID, just yesterday, I was in a panel last night with the Texas Jail Project, a wonderful group there of activists, and they work with a young man who just yesterday, 38-year-old guy, Billy Davis, arrested largely because he's unhoused. Bond was set at $25,000 for evading arrest. He's in Harris County Jail in Houston, transferred to Louisiana because they're overcrowded at Harris County, and they've decided they're going to transfer people out of state. He died in custody yesterday. This is happening every single day. Because he couldn't afford bail. This is happening. The sky is falling. Now, what do we do from a journalistic or narrative perspective in order to sustain the kind of momentum that I thought we would have early in the pandemic, but actually fell apart? We couldn't even sustain it during a pandemic where it's clear that this system is killing tens of thousands of people around the country. I don't know how we can generate the affective investment, the kind of energetic investment we need to make the changes that we need, but we have to do it. And I don't think it's going to come from more sophisticated studies. We have decades of evidence that show that our current policing and carceral systems do not serve public safety. They are not rational systems. The obstacle to change is not lack of data. It's not lack of sophisticated analyses. That's very clear. You watch President Biden's State of the Union address. That wasn't about data. That was about funding the police because that's a good line that gets everybody to stand up and clap. That's what determines politics. Until we have an ambitious framework that's out in the public discourse for, I think, real transformative change, we're going to have a very hard time moving forward. It's just, clipping a little bit here and there. And in my view, working with people who are passing through the system every single day, both in my psychiatric ward, but also in my ethnographic work on the south and west side of Chicago, where people are incarcerated at insane rates, I don't think that pruning is enough. We need a lot more. So I think, this is, maybe I'm going too far overboard here, but I think kind of a grand framework like the Green New Deal, for example. Now, has the Green New Deal come to pass? No, but how many Americans are aware of it? How many Americans are aware of this as a political horizon that they either disagree with or that they aspire to? A huge proportion. How many Americans are aware of something like the Breathe Act or a national decarceration program that seeks to have the incarcerated population in the US and radically transform how we fund social services so they're not directed to the police, but through actually community health workers, housing, et cetera? That doesn't exist in public discourse. Now, I think there are good reasons to criticize, for example, defund the police as a slogan, the effects it's had. On the other hand, defund the police has put something into the public discourse that was not there before. Nobody in America is not aware of this as a rallying cry, even if it's just in opposition to it. That brings something to the forefront of public discourse, demands politicians be held accountable to this. What's your position on this? No politician running right now is held accountable to answer what is your position on the national decarceration program with 50%, with the initial target of 50% reduction in incarceration and this kind of radical transformation of our budgetary priorities. That doesn't exist. Nobody's held accountable to it. And until that exists in public discourse, I think we're just beating around the bush and not really making the changes that we need.
Well, it's certainly sometimes it seems, the word that comes to mind to me in hearing you talk is the word empathy. And I feel like sort of as a society, the empathy meter has gone down considerably. And you're talking about a population, when you talk about people in prisons and jails and people who have mental health problems and they're the people who wind up at the far tips of our reach for empathy.
Yeah,
is what it seems like.
If I can just respond to that briefly, because I think so much, I'm an anthropologist. Anthropologists love to write these really moving ethnographies that elicit empathy. Empathy has been a core feature of kind of our field, of sociological fields in general, of journalistic work. In some ways, I'm very cynical about empathy or about compassion or about appealing to people's individual moral sentiments. It doesn't work. On a policy level, it doesn't really seem to work. I think what we need to couple these affective narratives that are full of feeling, but with a kind of political paradigm that understands that this is not just about feeling compassion or empathy for somebody who's suffering. This is about producing a society that is livable for a huge proportion of people that right now don't live in a livable social arrangement. And this is also about producing sustainable conditions for public health in the US. We are going to face other novel pathogens. We will face, as we do every single year, influenza waves. Tens of thousands of people often die from those. How many of those deaths are preventable? We need to do a whole bunch of things like build actually a functional healthcare system. But if we were to dismantle the irrational system of mass incarceration we have, a very large proportion, I can't tell you exactly because the system prevents us from having access to the data to measure these things, but it's huge. This is, I think we need to couple feeling with large-scale ambitious political projects and the data that shows that your self-interest is implicated. I don't care if you are an empathetic person. If you care about your family, your neighbors on the north rich side of Chicago, you should be behind this policy change. I think that's kind of more the direction I want to see going, because I see empathy as, I'm all for empathy in some ways, but it doesn't move the needle.
I used to think that pocketbook moves the needle, I'm less enthusiastic about that. As will civil lawsuit, big judgments in cities that are self-insured encourage police departments to do something about officers who repeatedly engage in brutality. I think the answer, based on my experience, is the pocketbook doesn't work. What do you think, Jennifer?
I think you got to ask the right community. And if you think about who is reading, what the press is writing, are you reaching the right community? Because if you're reaching a community that has, because of our wealth gap in America and what's been happening, increasingly removed from the problem, and you say they're the we, and they're the, if you let them identify America and say, America's less empathetic because this group of upper middle class people who have gated communities and punch in a code to get to their 2-story house, when most of America is renting, right, and may not read the paper, I think that is a misnomer. And I really strongly feel that way. And I think that how are you reaching the voices of the people most impacted? That's your we. That might be social media. That might be community newspapers. And those are the voices that I saw every day in court, crime victim or defendant or witness. That was the we. And so when I hear this, America is more political, I'm sorry, a lot of Americans are apolitical. When you hear like the noisy voices and you don't pay attention to the fact that they might be your upper middle class educated people who talk a lot and aren't personally impacted, I just don't listen to that anymore. And that's just me as a human being, not as an academic, because it's very frustrating to me. And I live personally on a street in rural America with 3 homicides down my street. So, and I teach criminal law, and I have a classroom of very diverse students, mostly first generation, some who are using the food bank at my university because they can barely make it and want to make a difference in their families. And they are so compassionate. And they listen to each other, and they're from all parts of the political spectrum. So this kind of painting America in this it's a light that I don't see.
Eric.
Yeah, I didn't mean that people aren't empathetic or that America is less empathetic. In fact, I would vehemently oppose such a thing. I don't think that arrangements, for example, in Sweden are better with respect to the carceral system because Swedes are more empathetic or they're better human beings. I think that's total bullshit. And that's why I don't think that the route to change here is empathy. We have empathy. Empathy is not producing the political movements and changes that we need. It has to be organized in a way that is effective to produce policy change. That's why I'm saying that I think empathy is in some way too limited as a vehicle. This is what liberal America, like caught up in political liberalism, loves to believe in, the moral sentiments of Adam Smith, etc. But the moral sentiments of Americans, which are there, are not adequate to overcome the forces that impose exploitative, extractive, violent systems like our carceral system, like our broken welfare system, like an exclusive for-profit healthcare system. The people that I meet, like you, Jennifer, like I agree, they are very empathetic. But how do we make that an effective vehicle for change? Right, as it exists right now, we have a journalism industry that feeds on empathy, but it doesn't produce the policy changes we need. And we're missing that transformative link. We need structural organization that we don't have.
Alex, what role can data play in this?
So it's critical. I think different people need different data in different ways for different reasons. And I say that all the time because I've talked to journalists, I've talked to people in retirement homes, I've talked to community members, and I can't show logistic regression equations to most people, and no one's going to read a 30-page article. I learned real quickly when I've testified in DC, if it has a paperclip or a staple, no one's going to read it. So we got to be able to take all of this difficult data that a lot of people, assuming we can get it, and that's a whole nother issue that both Eric and Jennifer have talked about, in a way that's digestible for us and we can be transparent about it. I think we've lived through a period of time where data wasn't used to at least inform the decision making. I'm not saying change policy, because that's a whole nother layer of above my pay grade, but we have to have data at the table to be part of the overall decision making. I think that there are success stories that have done that. There are cities that have started to do that and do it really well, that say, okay, what does the data show? It doesn't mean we're going to follow it all the time, but you got to have that part of the equation. So it is absolutely critical. I mean, people like us, we live in a world of data, right? And so, and journalists are very appreciative of data. I'm not convinced that the rest of the world cares about data. For a lot of parts of the world, their mind is made up regardless of the amount of data that I will show them. But there are some people who are in the middle who might be approachable and at least willing to listen. And I think, you know, a person with an opinion is great, but a person with data is armed.
John, we haven't heard from you in a while, which is perhaps unexpected.
I talked so damn much early, I figured I better back off.
I wonder if you could have any thoughts based on everything that we've been talking about here in the last 20 minutes or so.
Yeah, I really want to pick up on what Jen was talking about. I mean, that's my exact experience. I mean, I think that, you know, I think it's interesting that we have two things going on, right? I mean, I think that at the political level, we've never been more divided. But my experience inside correction systems, and just to give you my context, I've been out of corrections in Pennsylvania since October 1st and working with 10 or 15 systems between state and county jails. And I really do see a lot of alignment and a lot of commonality among the system players. And I think the optimism for me is at the local level. I don't think we've lost the ability to work together, regardless of political parties. I think that, you know, in many ways, I love, you know, Eric's kind of call to action. I think the path is really at local up. I mean, I think at the local level, we can still work together. And for me, I'm a guy who spent 20 years in the local level, where humanizing the population really wasn't part of it. I mean, we may treat people on the other side of tracks differently. We didn't question their humanity. At the state level and the way we've delivered state prisons and where we locate them, you know, humanizing the population is the first step. And I think some of the way the media, press, TV, those kinds of things exacerbates that. But I think the path is humanity. And I think it's really focusing on commonalities. But again, there's so many lessons that we've learned in a positive way through COVID, that the question is, can we capture kind of where we're at? Can we increase the value? I mean, part of this, the reality is part of this is a value statement on corrections. I mean, people love to complain about corrections, but if we value it, are we going to fund it appropriately? I mean, people talk about the condition difference between Europe and America. Don't talk about the funding difference. I mean, I was at a juvenile prison in Germany that had the same square footage inside the fence as my juvenile facility in Pennsylvania when I was sitting in that seat, with 3 times the inmates and a third of the staff. So there's a value situation, but I think, and again, I'll share kind of one last thing. One of the things I took away from my trip to Europe, and in Germany, I sat down with the Minister of Justice in East Mecklenburg, Pomerania, and she kind of looked like Judi Dench. I think that's okay to say, but she really did look like you, and I'm a Bond guy. So, and I asked her at dinner, I was like, hey, help me understand, like when I went to see German prisons, I was not thinking forward thinking, humanity, this and that. And she said, you know, when you lock up and incarcerate and kill your own citizens just for who they are, not for what they did, it changes your perception and your value on taking freedom, right? And that really struck me. And then here in America and in Pennsylvania, when the opioid epidemic kicked in, as weird as this sounds, and I'm not trying to be disrespectful to anybody, but I saw a similar phenomenon where people from all zip codes in Pennsylvania were impacted by the scope of the opioid epidemic. They, for the first time, many of them got an up close and personal look at the criminal justice system. And oh, by the way, like all of us didn't like it, right? Because we interpret behavioral health issues in way too big of a proportion through our criminal justice system. So it's hard for us to remember this, but before COVID, there was a big movement from both sides of the aisles around circling around the opioid addiction and talking about kind of decriminalizing our response, not necessarily decriminalizing drugs, but decriminalizing our response and getting to the root cause of addiction, those kinds of things. I would argue that's a similar phenomenon to what the Minister of Justice in Germany experienced. One more layer to get even more complicated. In my own system, as soon as I took over, I got sued by the Department of Justice for the way we treated individuals with mental illness. It was a legitimate suit, not by the Department of Justice. We weren't unconstitutional, but we were bad. And one of the things that came out of that was that we needed to retrain our staff and train our staff better in how to manage or work with individuals with mental illness. So our immediate response was to have every staff member go through an 8-hour training called mental health first aid. And it really trained them on recognizing signs and symptoms of mental illness. A really strange thing happened. Our staff, through this training, saw mental illness in their family members. And somehow I felt like it pulled us closer to humanizing the population. Because at least for mentally ill individuals with mental illness who were incarcerated, they saw some commonalities. And so I think my focus from that point on had been like, let's highlight the commonalities and kind of downplay the differences. So that's kind of where I'm at. Thanks for the opportunity.
Thanks very, very much to all of you. I think if there's so many takeaways, certainly the opportunities that, and I guess that's the word in quote, but that COVID has presented should be taken advantage of here. And also, one of the things that I'm hearing is talk to the local people, get the local stories, and hear those voices when you talk about people who are committed, and hopefully they will actually be willing to open up and talk. So listen, my round of applause to all of you. Thank you so much for what you do and for taking the time with us today.
Let me echo that. That was a great panel. Thanks to all of you for your time. We really appreciated it, and I hope you'll stay with us for the duration of the conference. We're going to take a quick 10-minute break and move on to our next panel, which will start at about 2:10. Thank you all.
Thank you.
Thanks, everybody. Take care.